좋은 작은 것 같아 너만 준비돼 있다면
Welcome to Sex at 10. I'm Rebecca Rosenblat, certified relationship and sexuality therapist and your host, here to answer your questions on all things intimate. Whether you're stuck in a relationship dilemma, have issues with your body, trust, trauma, addiction, or orientation, or just need a little help with turning up the heat in your bedroom, give us a shout at 1-800-968-7836 and let's chat. Everything's fair game. If you've thought about it, we can talk about it. Let's begin with the discussion on sexual health in the LGBT community. And to help me with that, we're being joined by an expert in the area, Dr. Joshua Diaz. Dr. Diaz did his medical degree at the Northern Ontario School of Medicine. During that time, he acted as the school's local officer of reproductive and sexual health, organizing events around World AIDS Day and International Women's Day to increase an awareness around sexual violence and abuse, as well as disability and sexuality. He then went on to act as the National Officer of Reproductive and Sexual Health for the Canadian Federation of Medical Students, where he led national projects and initiatives. He's also presented to the International Federation of Medical Students on the Day of Pink, an international awareness day on celebrating diversity and stopping discrimination based on gender and sexuality. Beyond that, Dr. Diaz hopes to provide hormone therapy for transgender patients in rural Ontario after finishing his postgraduate training in Toronto. So indeed, we are very proud to be presenting a man of his caliber to you tonight. Good evening and welcome to Sex at 10. Thank you so much for joining us tonight.
Thank you for inviting me here. It's such a pleasure to be with you here, Rebecca, and to be able to talk about a subject that I'm so passionate about.
A very important subject indeed. Dr. Diaz, one of the things that bothers me is the misuse of terminology when it comes to the LGBT community. So why don't we begin the discussion by you clarifying all the terms that are constantly misused to describe orientation, gender identity, gender expression, and such?
Sure. So oftentimes I'm sure you've heard a lot of these terms in terms of lesbian, gay, bisexual, pansexual, homosexual, bisexual, transgender. So what I'd like to do is talk about 4 specific categories. So the first is biological sex. So most people would probably know this as male and female. So these are the anatomical and physical characteristics to help define a person. But with these 4 categories that I'm going to talk about, it's not just binary. And I really want to focus on that. That's a really important point, that oftentimes they're a spectrum. So even with sex, you have a spectrum. So we also have disorders of sexual development. Also, people might know it as intersex. And so that's your biological sex.
Right.
The next part is your gender identity. So this is how a person identifies themselves. It's their inner sense of who they are as a person. And it's nothing that anyone else can identify for that person. It's a person identifying it for themselves.
And again, it's not binary either.
No. So you can have things like cisgender, transgender, agender as well. So again, everything exists on a spectrum. The third category is with regards to gender expression. So these are things like how a person talks, how a person dresses, interacts, and how they behave in society. And it often has huge undertones in terms of cultural and societal factors that affect it. So for example, like a male in society might act in specific ways depending on cultural and societal factors. So that's how a person acts externally. And then the last category is with regards to attraction. So as you know, attraction is not just physical and sexual, but there's also romantic attraction, and those can often be separate depending on individuals. And again, it can be a huge spectrum in terms of heterosexual or bisexual or homosexual or homosexual or asexual.
Or asexual.
Exactly.
A category that lots of people don't seem to recognize. And I have some clients who are asexual, and it's very painful for them because they're expected to identify with one of the more common orientations. So I'm really glad that more and more people are respecting and identifying that as a category unto itself.
Absolutely. And oftentimes people assume that people who are asexual are not romantic or don't want to enter in romantic relationships. And
Which is not true.
And so many assumptions are placed on these categories. So you know the acronym LGBTQ. So it's an ever-growing acronym based on all the different categories. You can add infinite letters to that. So a term that I actually like to use is gender and sexual diversities, or GSD. The reason why I like to use gender and sexual diversities is that it provides like an umbrella term, and I feel like it's more inclusive. So it provides kind of more of an inclusive term as opposed to choosing which specific letters you want to use in different situations.
I like that because a lot of people also feel very uncomfortable with labels, because with the label comes a lot of other stuff. Discrimination is one of the things that comes with certain labels. So I like the umbrella term that it covers everything and is really, really inclusive. And we're going to be talking about some of those things in a bit. Viewers, if you're hoping to gain some understanding into sexual diversity for yourself or a loved one who you're hoping to support, please call in with your questions. Dr. Diaz, even though people are more accepting of gender diversity in the new millennium, I feel we're a long way away from fully understanding, embracing, and supporting it. Tolerance alone doesn't count in my books. As such, many people in the LGBT community continue to be marginalized in various situations. So can you please discuss the impact of social and cultural factors that perpetuate prejudicial thinking around individuals with gender and sexual diversities?
Absolutely. So this is a huge topic, and it could be hours into of itself, but I'll
Right.
try and shorten it down. So as you know, people with gender and sexual diversities often have a higher rates of health problems. So in mental health, higher rates of depression, anxiety, substance use, suicide attempts, higher rates of certain cancers. And a lot of this, what I want to focus on is that it's not related to biological factors, but instead social and cultural factors.
Right.
And so there's this model that's been proposed called the minority stress model. And how this works is it looks at minority populations and it looks at the different stresses that they undergo in terms of perceived discrimination, violence, bullying, and it looks at how those factors actually affect minorities. And so they've done lots of studies with GSD populations showing that the higher the rate of perceived discrimination, the more likely that they're going to have different health outcomes, including mental health outcomes. So that's just one of the ways that we help explain a lot of the negative healthcare outcomes within this group of individuals.
That's really important that you're talking about that. I read a startling statistic in teen suicide, how much of it ties into this non-inclusivity and discrimination and fear of coming out and fear of how the rest of the people around you are going to treat you. And what always amazes me is even though parents don't want to know anything about their kids' sexuality normally, they just don't even want to know you're having sex, all of a sudden, if it's not the binary model, if it's not something that they accept, it becomes their business, and they start to define the person through that. And some parents can be really cruel. I've heard some really disheartening stories, and I always think, well, why is their sexuality all of a sudden your business now, whereas it wouldn't be under other circumstances? So do you have a quick comment for parents just to be more inclusive, or any kind of comment that you have that would help them?
Yeah, so social supports is a huge factor in terms of both the health and outcomes of GSD persons. So we know that suicide rates are higher if there aren't any social supports, and that has huge implications in terms of how they even exist in the world. So here in Toronto, up to 40% of the homeless population identifies as GSD.
Really?
And
That
GSD
high?
youth are 5 times more likely to be homeless than their heterosexual counterparts.
That's so
we know
sad.
situations at home play a huge role. So in terms of advice, I think that coming from a place of understanding when approaching your youth and when talking with your children, I think is very important. And then I think sometimes it's, especially coming from different cultural backgrounds, it's sometimes hard to struggle with some of these issues, especially if you're immigrating from a different country. And so there are
Conservative culture in particular. But I think that's really great that showing a greater understanding, because people don't realize the repercussions once they get the ball rolling in the wrong direction, that this could really hurt their child, or they could lose the child. Being discriminated against for my ethnicity, I know all too well what that feels like. So if any of you out there have experienced a similar sting due to sexual diversity and you'd like some support in finding resources to combat that, please don't hesitate to grab your phone and join our discussion. Dr. Diaz, since I work with a lot of people from the LGBT community who are struggling to accept their sexual diversity, some of the stories that I hear are horrific, as I'm sure you've heard, the most shocking of which have to do with our healthcare system. So much so that some of my clients are almost afraid of getting the help that they really need. So can you please discuss that next, aka barriers to accessing proper healthcare and mental health care for fear of prejudicial treatment?
Sure. So this is a huge area within medicine that really is starting to be addressed, but still needs a lot of work. So I'd say one of the big barriers is practitioner comfort and knowledge. So if practitioners don't feel comfortable in terms of a specific area of medicine, they're going to try and avoid it, and they're not going to accept certain patients. And then in addition to that, they're not going to provide the best care towards certain patients. So there's certain practitioners who haven't been providing pap tests for lesbian patients, thinking that they don't need it, or avoiding certain care with regards to transgender patients. So these can have huge implications. And I think a lot of this stems from how we're doing with regards to medical education. So a recent survey that was done with regards to Canadian medical schools across the country found that a median of 4 hours of education was done on GSD subjects in preclinical education, and a median of 0 hours in clinical education. So literally close to nothing. This was a recent study that done a few years ago, and things have changed since then, but I think that there's still a lot of work that needs to be done.
Absolutely.
And another barrier is, as you mentioned, with regards to discrimination. So transgender patients, for example, going into the Emerge or a walk-in clinic and being asked inappropriate questions like, have you done bottom surgery or top surgery, when they've come in for an ear infection, something that has no relation to the questions.
So it has no bearing. Is it curiosity, or is it disrespect? What's going on over there?
I mean, part of it is that lack of knowledge in terms of what is an appropriate question and what is not, and then what is important. So we're information gatherers, and part of our role throughout education is understanding which information is appropriate to ask for, and what's the right information to go for.
Yeah. Absolutely. Wow, 4 hours. I'm still amazed. And in general, I find that a lot of physicians, they're uncomfortable discussing sexuality, period. I was involved in a study where something like 67% of physicians never brought up things like erectile dysfunction, even as they talked about other below the belt issues. So there seems to be a little bit of a discomfort there, which is kind of sad. Viewers, if you have any questions on the subject matter or anything and everything to do with sexuality in general, please call us right away. Dr. Diaz, what are some of the solutions which can help make healthcare delivery more user-friendly for patients with gender and sexual diversities?
I think one of the first steps is resources. So, for example, if we look at transgender care here in Canada, so for transgender patients who do decide to transition, access to hormones and hormone therapy can often be difficult, and the cost of hormones. Access to sex reassignment surgery is hugely difficult. There's only one clinic across Canada that actually provides the full spectrum of surgeries. And so imagine the wait list, and then the cost implications if you're on one end of the country to get to the other to access the surgery.
And that's why some people go to other countries.
Exactly.
Because the wait list is so huge.
And oftentimes they'll go to different countries where the surgery might be cheaper, but where the health risk can be much higher.
So it's not as safe.
So it's not as safe, and then when they come back here, they end up with different health implications, and then they might even be in a worse situation than when they started out with.
Oh, that's so sad.
So other solutions that we can deal with is things that we've talked about. So some of the barriers in terms of education. So I think that if we start from a bottom-up approach and start with medical education and start introducing these topics much sooner, we can have a better widespread effect. And then even patient experience. So from intake forms, why do we have male and female checkboxes? We could have a blank space where people put in what gender they identify with. And why do we even focus so much on male and female in terms of labels on hospital bans or on hospital charts? Is that a label that's even necessary with regards to treatment? So even making the hospital environment, from posters and signs that are more targeted towards GSD patients, making it more inclusive so that when patients come in, they actually feel like they're accepted.
Yeah, so, at get-go, they shouldn't feel that, okay, I'm being put in one of these two categories, and what do I write, where do I write it? My own intake forms have sort of a blank space. At first I had the entire spectrum, but it keeps growing. So often people will ask me about that, but it's a great segue to have that conversation that might be difficult otherwise. And sometimes people will come for maybe for sex addiction or something else entirely, and we end up opening up a conversation just because of that intake form, and people end up feeling really open, and there's a place where they feel they'll be safe, they'll be accepted, there won't be any judgment. Can you stick around, because I have a few more questions for you, because I really want to talk a little bit more about some of the options that we were talking about initially, and just I have a few more questions, so thank you so much for sticking around.
Thank you.
We'll be right back. Keep your calls coming, and let's discuss sex, relationships, romance, or whatever else rocks your boat. And keep it locked on Rogers TV, because we have lots more great stuff still ahead, including your calls. So pick up that phone and call so we can connect. Don't be shy.